Hello, I'm Dr. Michael Steele, and welcome to today's YouTube video. Got a real treat for you today. I'm going to deviate from my normal plan, which is to bring you the world's most boring videos. And I've got a real exciting topic today, statins and cholesterol medication. Nothing really excites passion like talking about statins, at least on the internet, and at internal medicine doctor parties, I guess, maybe. So if you look on the internet, you're going to find all sorts of stuff about statins. I mean, there's videos about statins killing you like one cell at a time. You'll read down in the comments below and you'll see all these stories about people who they took statins and they almost died and they lost a testicle and then they stopped statins and like their testicle grew back. I mean, it's all this kind of stuff. People really don't like statins on the internet. So the question is, why does your doctor keep pushing this on you? Now, let's be honest. If you're a statin hater, nothing I'm going to say is going to really change your mind, so you're probably not going to like the rest of this video. On the other hand, if you're the kind of person who is wondering why a supposedly, fairly intelligent and well-meaning community of individuals would continue to prescribe these medications, even though they have all these problems you read about on the internet and other places, stay tuned. I myself am pro-statin in the sense that, I use them in my practice, I prescribe them, but I am going to admit statins have their share of problems. I think the guidelines have their share of problems, and doctors have certainly done a lousy job of overprescribing them in the past, and I think that's why there's all this backlash out there. Now, this is a pretty large topic with a lot to say and talk about, so I'm not going to be able to do everything in one video today. I'm going to split this into probably 2 or 3 parts, but for right now, I'm going to go over the cholesterol guidelines because this is probably the main thing that is causing your doctor to want to prescribe statins for you. I'm certainly not going to tell you the guidelines are perfect, but I do want you to be aware of the information that's out there and that your doctor is looking at, so you can kind of understand where he's coming from and so you can make some good decisions for yourself. Before I get too much further and get into the nitty-gritty of the guidelines, I just want to go over a little graphic I prepared just to bring a little perspective to this whole discussion. I can show this up. Sorry, bring it up here. Let me show you. So, okay. So I know the first thing all of you are thinking is, what the heck? This guy is not a real doctor. Look at that handwriting. You can actually read it. Okay. I did not do well in the doctor handwriting class in medical school. So I did good in the other classes, but not that one so much. So, but the point of this thing, I just want to show you. So this is the data from 2014 from the U.S. mortality data. You can see up there deaths from ischemic heart disease, which is things like heart attacks and things like that, is 365,000. That's like 1,000 people per day dying in the United States of heart disease. That doesn't even include like strokes. That's another like 150,000 or something like that. And over on the other side, you can see deaths from statins, which are these big, horrible, nasty, poisonous drugs that you read about on the internet. Deaths from statins in 2014 was 0. So I actually don't know if it's actually that number, but I couldn't find any information anywhere about statins causing deaths. So it's probably about 0. So just keep that in mind, when you're thinking to yourself through this whole process, which do I need to be more worried about? Should I be more worried about, heart attacks, or should I be more worried about the nasty, horrible statin drugs? Just keep these numbers in mind. I mean, is it a toss-up? The guidelines that your doctor is probably using these days are the American College of Cardiology and American Heart Association guidelines that came out in late 2013. So they're about 2.5 years old now, and they have certainly had their fair share of criticisms. These recent guidelines are certainly a departure from the way we used to look at cholesterol, at least most of us, before 2013. Under the old model, as I'm sure you're well familiar with, the whole goal was to get your darn bad cholesterol number under a certain level. So for most people, we wanted to get your LDL under 130. For high-risk people, we'd want to get you under 100 or even lower. And we'd do whatever we had to do to try to get it down. We would beat you with statins or niacin or red yeast rice, oatmeal. I mean, whatever it took. That's the whole goal, was to just get that darn LDL down. The new guidelines abandon this approach. The gist of the new guidelines is that we use your risk of heart disease and we match it up with whether you should be on cholesterol medication or not. So for example, if your risk for heart disease is low, you should not be taking a cholesterol medication, even if your cholesterol is quite lousy and very high. On the other hand, if you have a moderate risk of heart disease, then you should be on a moderate dose of cholesterol medication. If you have a high risk of heart disease, you're recommended for a high dose of cholesterol medication, even if your cholesterol may have been good or normal under the old guidelines. Your cholesterol numbers are still important in the sense that we use them to estimate your risk of heart disease, but they're no longer the target once a decision has been made to start a statin. They kind of explain in the guidelines that the reason they chose this method of decision making is because it turns out no matter what your cholesterol is, or no matter what your risk of heart disease is, if you take a statin, you can probably expect about a 1/3 reduction in your risk of heart disease. So for example, if your risk of having a heart attack is about 3% in the next 10 years, if you take a statin, you can reduce it down to 2%. So a whole 1% risk reduction. So that's not considered a good reason to take a statin. On the other hand, if your risk is 30% and you take a statin, you can expect to reduce your risk down to 20%. So that's a 10% risk reduction, which is a considerable amount and would be considered a good use of statin medication. It seems that this effect applies whether you have good or bad cholesterol to start off with. So people with good cholesterol, or at least normal cholesterol under the old guidelines, can still benefit from statins. So you might be thinking to yourself, this sounds a little fishy. Why would I need to take a cholesterol medication if my cholesterol is already pretty good? It turns out that even though we call them cholesterol medications, they actually do more than just lower cholesterol. And it turns out cholesterol is not the entire story when it comes to plaque buildup in your arteries. So the statin medications have other properties that prevent buildup of plaque, such as anti-inflammatory properties. And these have nothing really to do with their ability to lower your cholesterol number. The guidelines go on to specify that if you have a 10-year risk of heart attack or stroke that is 7.5% or higher, then you should consider being on a moderate or high intensity statin, depending on how high your risk is. And that would correspond to, a minimum 2.5% risk reduction is what they're looking at. But then they also go on to say that even all the way down to 5% risk, you could still consider cholesterol medication. So that's the guidelines in a little nutshell. There are a few caveats I should mention. Number one is that the benefits of statins are unclear if your age is over 75 and you don't have any history of heart attack or stroke yet. And it's also unclear if your LDL is very, very low to begin with, like under 60 or 70. We don't know if cholesterol medications really are effective in those situations. Also, they do mention that if you have low risks for heart disease, but your LDL is still very high, like above 190, you really should think about cholesterol medication. But there's not really any good science that proves that that's a strategy that works. I think it's more just a kind of a gut feeling that, we should do something if your cholesterol is super high like that. The guidelines do take some pains to explain that statins are to be used in addition to the real first-line therapies for heart attack and stroke prevention, which are healthy diet, regular exercise, getting to a healthy weight. Statins are not meant to replace those things. They're always meant to be in addition to those. That's always been the case, but doctors have done a really lousy job of emphasizing that. So I do like these new guidelines a lot better than the old ones, and I'm going to go over why I like them better in my next video. But there's also some things that make you go, "Huh?" And I'm going to go over those in my next video as well. So if this was interesting to you, I hope you'll tune in for my next video. And until next time, take care.